If you look at what I can do here, there's a ligament on the MCL. If I lock down the femur, can you see I can do a valgus test there? See that? Because if I do that, where's the movement coming from? The hip, isn't it? Because the hip's going in and the hip's going out. Yeah, not that we got much out. Yeah, we got loads of in. So from there, yeah. So from there, if I lock down the femur, and I can stress the MCL, can I? And if I lock down the femur, I can stress the LCL there. You see that? Yeah. From this position, now, I see people, when they test for meniscus, this is the Apley's compression test. When I push down, you have two choices. You can either sort of rotate, yeah, or you can grind, as the word says, Apley's grinding test, even though it's a rotation as well. Yes, you can have a rotate, yeah, or you can grind. Now, if you do that movement, the chances of having a meniscal tear in the centre, yes, it is common, but you might find if that's a meniscus and it's at the back, you might have torn it at the posterior horn. So if you look at it this way, can you see I put a little mark on that posterior horn there, just there? Yeah. So if that's the femur and that's the tibia, if I push and I do that, I'm only going to irritate the centre. So I'm not going to get the horn tear at the back. So what that means is you almost have to flex and rotate to get the horn at the back. So if you've got a posterior horn tear or an anterior horn tear, you won't get it by doing it centrally. Alright? So if you line up again. So what that suggests is, if she's got a medial meniscus posterior horn tear, you will not find it by doing this movement at 90 degrees. So you almost have to bring it over, then you grind it, okay, or you rotate it. Even, if I'm honest, even just leaning over, if your patient doesn't like it, it probably is a posterior meniscal tear here, on the medial side. The lateral side, if you lean it this way, can you see, watch what I do, okay? I can just do that, I can grind one way, or the other way, or just lean over, and that will probably catch it as well. It can also catch the cyst, you have a lateral cyst as well on that side. If you've got an anterior horn, bring it down, and I can do that one, so lateral, and then that one for medial. So that's more of an anterior horn test. Whilst I'm in this position, slowly bring your heel to your bum, please. So that's testing the hamstrings, so you can see the semitendon, the bicep femoris. If you've got pain behind the knee, then it might be hamstrings. It might be the gastrocs as well. So from there, you're not testing the gastroc, but if the leg is straight and you push your toes down into my hand, she says, yeah, I feel it, it might be gastrocs, I doubt if it's that. From there, if you slowly pull your heel towards your bum, that's more hamstring. Yeah, from there. And then one more, if you pull your heel towards your bum and I overcome my patient, so that's more eccentric, so she's contracting.
Cramped in my hamstring.
You're right.
Yeah.
Slowly pull in, and if I overcome her, and she feels it around this area, then it probably is a hamstring issue. So then we've done a few variations there. Pull in again, so that's isometric in a short position. Relax. Off you go. That's isometric in a lengthened position. Yeah. And then if I overcome her, that's eccentric. Because I can also ask her to overcome me. Overcome, overcome, keep going, keep going, keep going, keep going, all the way, and I'll be concentric. So you can vary how much you're doing that. There's, as low as you can do, you can turn the leg that way, pull your leg, that's more bicep, push up. That's more bicep, turn the leg that way, that's more semis, push up. And that's more semis. Yeah, so you can do a few variations there. Any questions on it? So we did the cruciates, meniscus,